Our next speaker is Alexia Kovlari. Am I saying that correctly?
Yeah, that's right.
Great. And so she's a first-generation college graduate from the University of Illinois at Chicago, who majored in biology. And she's also a former cancer researcher and emergency room research assistant. So whenever you're ready, you can go ahead. Thank you.
Sure. Hello, everybody. I hope everybody's doing well and staying safe during this pandemic. I just wanted to let you know a little bit about myself. So I'm a first-generation college graduate. I was really happy to graduate this spring in May. We had like a virtual graduation, but that's fine for us. Also, I majored in biology. I didn't have any minor, but I had a lot of research experience because I really liked research since I was like in middle school. Something about that I want to let you know, especially like incoming college students, about research. I know that everybody's saying that research is not like that important to medical school, but I believe that if you show that you're more capable in also like research or like clinical research, it's like something like a plus to your application. What I did was I was first at Loyola University of Chicago, and because they didn't have any research opportunities there, I transferred to UIC while I was in my sophomore year, and I tried to find research opportunities at UIC. They had a lot. There were like a website that had like a lot of professors that were doing research. It was either like, you could do like everything, like either biology research, like well lab research, or like clinical research, or IT research. It was like a ton of opportunities. I tried to stay with the wet lab first. It was a nice experience. I wouldn't lie. I learned a lot of like basic skills that I needed in my like labs that I had like at UIC. We're learning like PCRs. We're doing like gel electrophoresis, and it was like a lot of fun. But it was like a lot of time also. Like they wanted me to be there at least like 20 hours per week, and I wasn't staying at UIC. I was staying at my home, so it was like kind of difficult to be like there for like 20 hours. So I basically left the well lab research. I found another one which they had like a master's student, they had like a PhD graduate, and it was kind of like more organized, and they told me what to do, and I wasn't doing everything by myself. That was a really nice experience also. We were trying to be published, but since I was like just like a junior, it wasn't like a fun, I wouldn't do like much. Like I was just doing like PCRs and gel electrophoresis again. Like I was learning from the PhD students, I was learning from like the master's student, but still, I really loved the wet lab experience. But like I said, it's like a lot of time, and if you can commit and like if you stay on campus, it's like a really great experience. But for me, it wasn't that much. I wanted more to like have like a clinical research experience. So after I did like lab research for like a year and a half or so, then I found a clinical research opportunity. It was from the UIC hospital. It was like, it was a study funded by NIH, National Institute of Health. And it was basically about to find patients. We were working in the emergency department with other doctors, nurses. We were seeing patients. Usually it was like my shift was like 8 a.m. to 12 p.m. Then I would go to classes. Sometimes it was like, I would stay even late, but we had like shifts. It was like 1 or 2 shifts per week. I started like June 2019, and because it was like the whole summer, I didn't do anything else. I took all my summer classes like in my freshman and sophomore year. I was full-time doing that clinical research the whole summer of last year. I was doing like probably 3 shifts per week or 2 shifts per week. So basically what we were doing, we would go to the emergency department. We would introduce ourselves to the doctors and the nurses. We would say that we are the touch participants, like the research assistants about that project. They would say, oh, okay, if you need any help, let us know. Then we would log into Cerner, which is like a program which you can see like the patients, like what doctors see basically, like the patient's name, age, the condition, their blood pressure. And what we were interested mostly was their age and their blood pressure, and if they had like any pain. So if they had like a high blood pressure, that was like kind of concerning. We would go and approach the patient, and if the patient was between like 18 and 75 years old, and if they were in pain, we wouldn't approach them. So it was like, we would see that their blood pressure was high, would approach a nurse, would see, can we approach this patient? And the nurse or the doctor would say, yes, you can approach this patient. We would go to the patient, let them know about the study. They would consent. Then we would ask them some questions. We had like an iPad with us with like the questionnaire, and they would let us know the answer. We would like log it into the computer, to the iPad, and consent. And then we would measure their blood pressure like 3 times. And after that, we would let the nurse know that that participant was recruited to the study. Also the pharmacist, because sometimes the patients didn't know that they had high blood pressure. They said like, oh, okay, we have it, but not like consistently. So it was kind of like, oh, okay, now I know that I have high blood pressure. And the pharmacist would go with them and let them know if they want to take any medication. If they were taking any medication, it didn't work, they could try like another medication. And we would check back with them in 3 and 6 months. But those who had like their blood pressure was very, very high, we would give them home a blood pressure cuff, which was basically, they would measure the blood pressure at least 1 time per day. But lately we made it to like 3 times per week because they were busy. And they would come back again, let us know how they feel. So basically it was to reduce like the high blood pressure in underserved community, because most of the patients in the UIC emergency department are like African Americans and Hispanic. So it was a really great clinical research experience. I recommend, like, if you find a clinical research opportunity, to grab it, literally, because interacting with patients was one of the best thing that you could possibly do. Also, like seeing the emergency department, how doctors work, how nurses work. It was something like, oh, like I said, I really love the emergency department. And like, I'm thinking right now to like, when hopefully go to medical school to become an emergency room physician. But it was a great experience. And I was also, because I was like the whole summer and many months, other college students would come, and I would supervise them and let them know how to do the questionnaire, how to approach the doctors, how to approach the patients. Patients were very nice with us. They were telling like stories about their life. It was really, really nice. We also got like a certificate of like BLS, and also like HIPAA certification, that basically it's like, you know, that you wouldn't tell their, it was like a private conversation and private information that we would only see. We have meetings with the clinical project manager once a month. What else? Also, we would like kind of like shadow the doctors, because we would go like to the patients, and like the doctor would like approach the patient and ask them other diseases. We would, the nurse would like take blood. Oh, and also we're taking blood because we were measuring their cholesterol, and we learned to do that by the EMTs that helped us with us. In the first like few months, like the whole summer, I learned how to do it, but they told me like, you should let the EMTs do it because it's like kind of like their job. But I wanted to learn more, so I was like, I'm going to learn. I'm going to do it by myself, but I'm going to let the nurse just poke them. and I'm going to take like the blood and put in the sample and see their risk because their risk because of their age and also their high blood pressure and cholesterol. So yeah, the clinical research experience was really, really great. I think the study is still continuing given my department at UAC. I left because I graduated and I wanted to have like other opportunities. A lot of students wanting to join that program. So yeah. Also, what else I did during my college years was leadership QAC, which was like a really, really great experience. Leadership QAC is like basically like an experience about people that want to be leaders. It was a lot of pre-health students and also like pre-law students. And we did the application and we were like the top 30 students, top 30 senior students that were, I'm sorry, we were the top 30 senior students that we were accepted. We had like a lot of speakers. We would meet like once per week, once per month actually. So we will meet like August since we started. We had like our orientation, September, October, November, and it was until May. And basically what we were supposed to do is to find a huge problem at UAC and find a solution with it. We had like businessmen coming to speak with us, law professors coming to talk with us. We were supposed to meet the chancellor of UAC, but because Corona happened, we didn't. But we had like a presentation in the end in May with our solution about the problem. And we basically learned a lot of skills. We had to learn what leadership means to us. We had to be like, our friends had to feel like a questionnaire about us and how we were like feeling as leaders, how we were interacting with them in everyday life, like as leaders. And that gives us like a lot of perspective of how other people see us. Yeah, that was leadership UAC. It's still going on. Our first time was like a pilot program, so because it went really well, it's still going on. And also shadowing. I shadow a little bit, not too much because Corona happened, and I was supposed to shadow like the whole March, April, May until I graduated. From the doctors that I was in the emergency department, because as you interact with them at least 4 hours per week, you get to know them and they get to know you, so you have like a really good connection. Yeah, some of the difficulties was of course the classes. As a pre-med, having to manage the time between research, volunteering, classes, exams, going back and forth to school and coming home. Yeah, it was a lot. I'm not going to lie, but if I can do it, you can do it too. So don't be courageous, you can do it. Also, some tips that I want to give out is that time management is like the key. Like you can plan out your day, like at least like Sundays, you can plan out the whole week. I used to do that and it really helped me. Like I would say, oh, today I have to do that. I have to call this professor. I have to go to their office hours. Also, something that I kind of regret was like because I didn't have a lot of time and I was like focusing more like on the research and my classes. I didn't go to the office hours of the professors. Please do that. It really helps. You get to know more of the material. The professor gets to know you. Get a lot of good recommendation letters. And lastly, I want to talk about my cancer research experience. I found that after the wet lab experience, and it was a great opportunity. Basically, the data was already made by other students, by PhD students, but we had to learn and see how the genes were affected by other genes, and I had like some chemicals that were given to me and see like how they were helping to fight cancer. And we would like, we would read articles, we would talk with our professor, with our PI, and we basically presented our abstract. And I was the main author of mine, and I was a co-author in other 5 abstracts in March. And that was a great experience, and we're still waiting to get published. We have to write like our whole research, because that was just like the abstract. Yeah, this summer. And about equity, I have been bullied. I have lived in a country where racism was pretty tough on me, and I know how it feels to be excluded from the whole society. So I wanted to be a doctor. Since then, I felt how the doctors helped us, and other people helped us, and I wanted to help people, but I didn't know how. And because I was good in science, I love like chemistry, I love biology, I figured that doctor will be the best call for me. Yeah, if you have any questions, because I don't see any here.
I have a question actually.
Sure.
So what was your favorite, I know you've done a lot of research, but what was your favorite abstract, for example, or specific study that you worked on out of all of them?
Mm-hmm. Definitely the clinical research one. I interacted with patients, learned how to measure high blood pressure, cholesterol, interact with doctors. That was the best experience ever.
Great, thank you so much. The next question is, are you studying for the MCAT, or did you already take the MCAT?
I already took the MCAT. I'm applying though next year, because this year Corona happened, and if you know, the interviews are being online, and I didn't want to risk that, so I'm going to apply next year.
Great, thank you. The next question is, can you provide some tips on writing a unique personal statement? And what are some important questions to ask yourself when writing it?
Sure. So tips regarding that, I would say your story. If you have like a disease, if your parents had a disease, if you have like an accident, if you have been bullied, if you have been racially profiled, you can write about that, like for sure. This is like your story. You have to be very specific on like why you want to be a doctor, and how that experience affected your life, and how do you see like other people, and how you see yourself helping other people. Because I know like everybody is probably telling you that don't do it for the money, or don't do it about like the status, and that's true, because you have to be there like almost the whole time, especially if you're like the emergency department. You have to be there for the patient. You don't see yourself anymore. You just see the patients, and you just want to help as much as possible. And in the world that we live right now, that's probably the best job to do, because there are a lot of inequalities. And what are some important questions to ask yourself? I think I answered that already. Like, ask yourself why, where do you want to see yourself by helping people? If someone has helped you a lot and you were like really grateful for that. I see another question. Do you have a specific specialization in mind yet? Probably emergency medicine, because I really liked it. It was like really fast paced, and a lot of doctors, a lot of nurses, a lot of diseases. Like, I learned diseases that I have no idea, I never heard before. So emergency department probably. What was the hardest class you took in college, and why? Oh, organic chemistry, definitely. That was the hardest class I have ever taken. It was hard because the professor wasn't teaching it as much as he could, but also I wouldn't like practice it. I was just like studying from the book, and I wasn't really like drawing the hexagons and stuff. So yeah, that was like my mistake, that I wasn't practicing a lot. So definitely practice a lot on what you learn. What did a normal day in your life look like, and what was the busiest day in your life? Okay. A normal life in my life was like waking up at like 6 a.m., going to the emergency department at 8 a.m. Until 11:45. Then I would catch the bus, go to my classes until like, I would say 5 p.m. sometimes earlier. I remember what semester, like fall of 2019, I took like 7 classes, which was probably the worst semester ever in my entire life. Then I would go back at my house, come back like 7 or 8 p.m., take a shower, eat, study until like 3 or 4 a.m., then sleep for like 3 hours the next day, go to class like at 9 a.m. And yeah, it was just like 11 hours, 12 hours. The busiest day, I don't know, because sometimes like it wasn't, I didn't have like a strict schedule. And like when I was like going to the emergency department, I guess that was my busiest day. Do you have any recommendation for us to do anything during quarantine? Is there something you regret not doing? Okay, during quarantine, if you're applying to medical school, probably like next year or I don't know, this year, try to study for the MCAT. Like start like low, just the basics. Don't like go crazy on that. But because for the MCAT, you have like to study for at least like 4 to 6 months, I would say, to just be sure 100% you will do great. Regret something not doing. So during quarantine, I had classes, I had exams, I was doing my research paper. I was really busy, but I was also like finally just sleeping, and now like sleeping at 4 a.m. So that was good for me. I regret not going outside as much as I could, because I remember one week I just stayed home like the whole week and I didn't go out the whole week. And that was pretty bad because, yeah. How many medical schools do you plan on applying to, and why? Okay, so I was planning to apply mostly to DO schools because I really like their mindset. And but now I think that I'll also apply to MD schools. How many? I don't know yet. Probably 20, 30, I would say. And why? Yeah, because I believe that DO schools have like a great mindset and they see the whole patient, not just their disease. So I really like that. If that answered your question. Did you get enough of sleep during this semester? This semester, yes, finally I did. I was sleeping like 6, 7 hours, which was great for me. I would never sleep like 7 hours, like never. Since high school, probably. I never slept like 7 hours. Probably on the weekend, but now like during the week. What do you wish you had done differently in college to make yourself a more competitive applicant for med school? Definitely do better in my organic chemistry. Start research earlier, not like in my junior year, because I was like too late and I had like to rush everything. But I didn't have a choice. My previous school didn't have research opportunities. So yeah, you can like just study the school that you want to go to, the college, or if you're in college, try to like transfer to a better one, because sometimes that might help too. Do you have any tips to start doing research? Yes. So go to the website of your school, go talk to professors, TAs, if you know any PhD students, and ask them that you want to do research. They usually get a lot of students. It's not like a big deal, but it's like the time commitment. Like you have to be there for like 5 or 6 hours per day. Like in I had like friends that were staying there for like a whole night, or like it was a Saturday that they stay there from like 9 a.m. to like 9 p.m. It was just a lot. That's why like I went to do more clinical research. Any other questions? What to expect? Yes, absolutely yes. But sometimes in my life, like the previous research lab that I went to, I asked them how many hours, and they'll say like, oh, just like 2-3 hours, like per day or so. And it ended up being like more than 6. How did you send out college? How did I send out in college? That's what you mean, Ethan? Yeah, okay. I would say basically on my research, because that was like the main thing that I guess opened a lot of opportunity. I grew like academically a lot. Like I was studying more like abstracts and papers that were published, and that just grew me a lot academically.
I think if there are no more questions, is there anything else that you want to finish off by saying?
Yes. I had a lot to say, but I guess this will be my last one. So I would suggest, if your school has like how is it called? It's like so basically what I did, I went in December of 2018 in Honduras. It was like a mission trip that we went with other doctors and other pre-health and pre-dental students. Those pre-dental, pre-health, pre-pharmacist students. We gathered like a lot of money. We went there, we would shadow the doctors in there. We would see the patients. We learned to take vitals. That was a huge plus for me when I went to the UAC emergency department. I knew how to take vitals. We learned how to use a stethoscope, the blood pressure. That was like a really big thing. And I know that a lot of at least DO schools really appreciate that, like going to mission trips, because I know that some of the schools, like in their second year or like third year, they go to like in the South America to do mission trips like that. And if you already do that, you show like you have like community service, except of like, of course, your volunteer hours. And I think that's like also a great opportunity. I went with, it's called Global Brigades. Your school might have a chapter with Global Brigades, so search into that.
Great. Thank you so much. That was such great advice. We really appreciate it. Yeah, and it was awesome to listen to like all of your research experience. It's so impressive.
Yeah, it was a lot of time though. I was really tired, trust me, and I still cannot believe how I handled all of that, just like sleeping 3 hours and just doing everything. It was something that I wouldn't suggest. Is what I say, like start early on your research in order to not rush like me.
Thank you so much. Yeah, have a great rest of your night.
I really appreciate it. Thank you.
Thank you.